Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. It's my pleasure to have Dr. Nosheen Naveed with us today. She is a medical doctor, and I will just request her to please introduce yourself. Dr. Nosheen.
Thank you, Dr. Mushtaq. Hello, everybody, whoever is watching from around the world. My name is, as Dr. Mushtaq said, Nosheen Naveed. I am a radiologist here. I am a graduate from Pakistan. Pakistan, a small town, Nawabshah in Sindh, from People's Medical College, Nawabshah. After graduating, I did a residency in Pakistan at Dow Medical College in OBGYN, and then got married and came here about 24 years ago. 27 years ago. Came here, and then I went through the whole process of being a foreign graduate, through whole process of doing all my USMLEs, and then after doing the USMLEs, I secured position into radiology and did 7 years of radiology residency and fellowship. 5 years was residency, and then 2 years of fellowship in neuroradiology and pediatric radiology. So it's hard for foreign graduates to come here and do everything step by step and go through the residency and then go through the exams and all that. So today we are going to guide you how to make it easy, either before coming here, or if you already have a visa and you want to come here and then apply, then I will guide you how to do it. Easiest ways to, during your medical college, start preparing for step one. So there are three steps in USMLE, as everybody who is following knows that there are three steps: step one, step two, and step three, right? So after your third year, you are eligible to appear in step one exam, and that is all clinical and non-clinical exams. So everywhere in wherever you guys are, you go through the non-clinical stuff in your first years and second year of medical school, and some third year. So after third year, if you prepare for step one, and it's on the internet, on all online, so you go to the center and take your exam after preparing good. Don't take a premature exam, because the number of attempts also counts here. So always prepare good. Go for resources on online, and then there are all sort of resources available. Books are available. Question pools are available. There is a World Bank, Q Bank, which is available online, and everybody goes through that. It is the same thing as all American students in American medical schools go through the same process of step one, step two, and step three. So after second year, all American students go through the step one, but we take step one after third year, because our system is mostly in European countries and in Middle Eastern countries and in Eastern countries. Our medical school is for 5 years. Here, the medical school is, you are done with medical school in 4 years. So the difference is we go through the non-clinical stuff in first year, second year, and third year. And after third year, if we take step one, then we score really good. But for that, you have to have this in mind, that I have to prepare thoroughly and then do all the U world, and then go and take that test. And after that, you will do good. Now, before, few years before, step one was either you have to secure like 75 and above percentile to pass that exam. But now it has been a little bit different, that you have to just pass. So you don't have to like take a score or compete with other person. Everyone who takes the step one has the same result: pass or fail. Same for American graduates. So you are not competing with anyone, neither with American graduates nor with any other person. You have to just pass or fail. So it's really easy to take your step one exam after third year. And after final year, when you are done with your final year, keep on studying for fourth year and final year. After fifth year, when you pass your exam, you simultaneously take step two and step two CK. Once you are done with step 2, then you have to have a clinical skills exam, which you have to come to America and to secure visa first and then come to America. Usually, if you have a date that on this date we are going to appear in the clinical skills program, then the visa process is much easier for you, because you just walk in into the embassy and show them your schedule that on this date I'm going to appear into the clinical skills program, and most likely they will issue you a visa if there is nothing else wrong with your status. This being said, now step 2, you have to secure really good marks. It's not a pass fail exam, it's percentile. It's based on the percentile. So you have to be on the top of the score pool and for the same year to get a residency here. After step 2 and clinical skill exam, um, you have to have a visa and then you come here. So before all, just a reverse back, people who are in their medical schools, if they secure some kind of observership in America or a research for a month or two, or some kind of observership which people either pay to the universities, big universities, and they can secure their spot, or if you know some doctor who is working here, they can accommodate you, they are allowed to accommodate you. But if you go to the university program, it is much better than going to individual doctors. But either way, anything on paper will look good for you guys to secure one or two slots for like a research or for observership. That will count when you apply for residency. Purpose is they want to know that you are fluent in English, and another thing is you know how system works in America. So that goes into your own favor. So after doing step 2, you don't have to have a step 3, because it's for a licensing. You can have that step 3 during residency. But if you already, before applying for residency, you go through the step 3, that will make your application strong and you will have more invitations for interview than without step 3. So it is always good to go through the step 3 and then apply. But either way, you can apply without step 3. A step 3 is not necessary for applying into any residency. So getting an visa is a real issue. So make sure everything is in line. You have papers in line, you have resources, you have a bank statement with you that we can afford our ticket, we can go there, we can stay there for 2 or 3 months to do our interviews. After COVID, many hospitals were offering online interviews. It's same now also, but few university programs are big programs. They will invite you to come and visit them. But still, 75 to 80% of interviews are online. So you don't need to have a visa for that if they are offering you online. For how long they are going to continue this? For now, it is online, but it can change in future anytime they want to. It's not in our control, right? So when you apply for residency, if you have a really high score and you have a research, then apply for like whatever you feel like going to, like ophthalmology, skin, or surgery. But those are really highly competitive residencies, and you are competing with American graduates, so it's really tough to get into. So realistically, if I suggest you, if your scores are mediocre, then go for internal medicine, family practice, peds, emergency medicine, and pathology. These are 5 things in which you can get your residency very easily, because they are, though they are competitive, but not as competitive as other fields. So now if you are aiming for surgery, for ophthalmology, for any other specialty, radiology, you need to have a 99 percentile in your step 2, which you guys are like international students are getting very easily. But then you have to have a research, you have to have few papers, you have to have like one or two attachment with those American doctors for radiology, for anything like that. So my advice is to get secure a good internal medicine, pediatric or family practice position and emergency medicine too, and then try to do a good fellowship, like a really good fellowship of your own interest. Now again, people are interested in cardiology, it's really a tough fellowship to get into. But the fellowships like endocrinology, though competitive, rheumatology, but infectious disease, you can get into those fellowships easily if you are doing good in your residency and you have a good recommendation letter from your program director. So all depends upon luck, and after luck your scores and your dedication to your field. You do good on your scores are good, you are going to get a good residency spot. But if you want to do an ophthalmology, you have to come here as a researcher, do your research for 2 years, 3 years, and then depending again on your luck, you can try for ophthalmology. I have seen people getting into ophthalmology, but it's not an easy thing to do. After ophthalmology, general surgery. General surgery, they'll give you prelim position, and you guys are very happy in that okay, we will take this prelim position. But after prelim in second year, they'll tell you that we are not going to move forward for second year. You go and find another spot. Then another spot in surgery is going to be very difficult, and you are going to end up again into either internal medicine or family practice or emergency medicine. So my advice is either you are very much dedicated or you have super high scores and you have a research with you, then go for those fields. But if not, and you just want to be a physician, then apply in these four things and then go for a good um, fellowship after your residency. Now, people who are already attendings, like the practicing physicians, and for some reason they want to leave their country and come back, but they don't want to go through the residency again, right? So the internal medicine residency is, as you all probably know, 3 years. Family practice is also 3 year. ER is also 3 year, and these are, and the peds residency is also 3 years. Rest of the residencies are more than 3 years, extending from 4 year to 5 years to 7 years also. Like neurosurgery is 7 year, general surgery is 5 year, radiology residency is 5 year. So those are long residencies. 3 year residencies are only internal medicine, peds, and ER, emergency medicine. So if you are a physician there and you have a change of heart, change of mind, and your circumstances, and you want to come and you don't want to go through this whole rigorous thing, during COVID, government has allowed about 12 states so far. You can still, you have to have a step one and a step two, not a step three, but step one, step two, and clinical skill exam. And then you can find some person who will supervise you, who is an American graduate working in that state, who can supervise you for, depending. Some have 500 hours, some have 2 years, some states have requirement of 3 years, some have 5 years, and there are certain other criteria. But somebody has to agree with you that okay, you come and I will supervise you for that many hours or that many years, and after you are done with those years, they will give you full license without going through residency. So that's your one option for all those people who are doing internal medicine, peds, ER, these kind of residencies back home. For people who are specialized, like in radiology, I'm giving you an example of radiology, but same applies for surgery, for ophthalmology, and all those other subspecialties. If you have a postgraduate degree from your own country or from England or from any other place, you have a post, for example, in Pakistan, we have FCPS, right? So, for example, if there is a radiologist who has FCPS degree and is practicing there, they have a different path to avoid that residency and work in America. That path is through university programs. So you keep on writing to university programs and send them their CV and see if they need. It's also always a need base. If there is a shortage of something, for example, now there is a shortage of radiologists in university programs. So if you call like 20 universities, and out of that you get response from one, and they are willing to take you and they are willing to sponsor you, without doing any residency, just with step 1 and step 2, you can come to that university. You have to work 3 continuous years in that university, either in general radiology or in 3 different specialties like a neuro, peds, and chest. You go through 3 years of, you have to stay in the same university. You go through 3 years, and then they will allow you to work as an attending there. You are still working as a junior attending there, but then they will allow you to be like a full attending there without going through your USMLE. And then they will allow also you to sit in the boards. So you can sit in the radiology board, into surgery board, and then pass your exam and become a full radiologist and can practice then, as we all are practicing. So that's another route for the people who have a postgraduate degree from either their own country or somewhere recognized, like FCPS. Many people know, if you have a gynae degree in MRCOG from England, they recognize here that degree, and then there you don't have to go through the whole residency process. So this is an alternate route for people who are already postgraduated and doing as a assistant professor, associate professor, or even in their private practices. They can take that route and come and practice here after going through 3 years of consecutive training from same university. So difference is, what is the difference then? Okay, so you have to stay in a university program, right? And only difference is the pay is low in universities and higher in private practice. But with the same token, you don't have to do the residency, so you are still getting better paid, and a university program is taking you, which will be an honor for you. And then after 3 years, you are going to go and sit directly into the postgraduate exam and be a whole, like a full-fledged radiologist, general surgeon, or whatever the requirement of that field is. But you have to stay in a university program. You cannot go out and practice without any university. So under the supervision of the university, under the umbrella of the university, you can still be an attending and can work in America. So we are going to provide you that whole the states which take you out of your medical school as a junior person, and we are going to provide you the link. Follow those states rules and you can come and practice here. Thank you. Hope it helps you a lot.
Yeah, we will have the list which Dr. Nosheen had mentioned. We will put it in the instructions of this video, so you can refer that. And if you have any questions, please go ahead and put your questions in the YouTube videos area where question and comments are there. They're welcome. Then we'll go back and try to see if we can answer the questions. So until then, we will talk to you again.
Thank you.
Yeah, bye-bye.
Bye.